Well, good morning, everybody. We are so delighted to have you with us today for a very important event, Understanding Mental Health, When to Worry and How to Help. We have with us Dr. Charlene Mendel from Child Mind Institute, and this topic could not be more important. As we know, mental health has been top of mind during the pandemic, and now as schools begin to reopen, it's even more important. So again, we are so grateful to Dr. Mendel and Child Mind Institute for this event today. We are sponsored by the Sequoia Healthcare District in partnership with the Parent Venture. So thank you so much for making that possible. This event has also been presented in Spanish and is available on our video library. Today's format, Dr. Mendel will talk for about 40 minutes and then we will wrap for the day. This is going to be a great event and we are looking forward to it. Let me tell you a little bit about today's featured presenter. Dr. Charlene Mendel is PhD, PsyD, is a clinical psychologist and manager of clinical services for school and community programs at the Child Mind Institute. Dr. Mendel is committed to increasing access to care and promoting the dissemination and implementation of evidence-based interventions. She has expertise in school-based initiatives, including training school personnel, providing school consultation, and engaging in school-based clinical care and research. Dr. Mendel graduated summa cum laude from the University of Pennsylvania and received her doctoral degree from the Graduate School of Applied and Professional Psychology at Rutgers University. Please join me and everyone for a really warm welcome for Dr. Charlene Mendel. Take it away, Charlene.
Thank you so much. Thank you for having me here today. I love speaking about this topic because it is so important to identify when kids may be struggling. I know parents right now have so many questions about how their kids are doing. And today I will be going over the signs and symptoms, things that you should be on the lookout for when you may need to seek support from a mental health professional and how to help your kids. I'm with the Child Mind Institute. We are an independent national nonprofit dedicated to transforming the lives of children and families with mental health and learning disorders. And we do this in three ways. One is through research, the other is through clinical care, and we have two offices, one in the San Francisco Bay Area in San Mateo, and the other is in New York City. And we provide care both in our offices and in the schools that are in the surrounding communities. And then we also provide public education. So we have a resource-rich website, childmind.org, and we have many initiatives that aim to bring evidence-based information to parents, educators, and policymakers, and that are designed to decrease stigma around mental health. Our goals for today are to help you understand some of the most common mental health diagnoses in children and adolescents, know what to look for in your child's mood and behavior, know when you should worry and how to support your child, and then finally know where to look for more help and the types of questions you might want to ask. Before I dive into the various mental health concerns, first I just want to talk about what is mental health. Mental health refers to our overall well-being. And there are biological, psychological, and social factors that all impact one's mental health. And your mental health is your overall well-being, even in the face of life's normal stressors, being able to still contribute to your community and overcome these stressors that happen. And of course, we all have mental health concerns from time to time. Life can be stressful, life can throw us curveballs, and we may have some difficulties weathering some of those at times. But these mental health concerns become mental health disorders when we see that there is an impact on our functioning, when we see that it gets in the way of us living our lives, doing our jobs, going to school, whatever it is that we are meant to be doing, or when we see that these symptoms last for a longer period of time or more intense than we might expect for a child his or her age. So I'll go into, as we go over each of these symptoms, I'll sort of contextualize them for what may be expected and what may be cause for concern. First, what causes mental health disorders? It is important to know that mental health disorders are not a choice, and there is no single cause. But we do know that there are different risk factors, and these may include biological risk factors like differences in the brain, genetics, environmental exposures before birth, or other social stressors like trauma or life stressors, or lack of social support. And these are just examples. Mental health and learning disorders affect 1 in 5 children. This is 17 million children, more than the number with cancer, diabetes, and AIDS combined. So many children are impacted by mental health and learning disorders. And most of these disorders onset in youth. So 50% before the age of 14, 75% before the age of 24. And unfortunately, what we see is that more than half of these kids who have a diagnosable mental health disorder do not receive support, do not receive care and treatment, or we see a very long delay in service initiation. Some estimates range from 6 to 23 years. It's a very long time. Even just a few months is a long time in the lifespan of a child. And we know that unaddressed mental health disorders can have a significant negative impact on a child's life. So the fact that you are here learning about what to look for is so wonderful, because the earlier you can intervene, the better. I know some parents will say, oh, I think he'll grow out of it, it's just a phase. And the early identification and intervention can do so much for your child. So how can you be on the lookout? And I want you to know that kids don't always have the words to describe what is wrong. So you need to be kind of looking to see what any changes in their behavior and asking questions. So observe their behavior and then ask how they're feeling. Give them time and space to listen. We want to make sure that we're opening up the dialogue and giving our kids a chance to share what's going on for them. So if you notice that, especially at this time in the year, that kids are getting a little fatigued, if you notice that they haven't been attending one of their Zoom classes, or that they haven't been turning in their math homework, to say, hey, I've been noticing that you haven't been turning in your math homework lately. What's going on with that? Or I've been noticing you've been getting more testy with your brother lately. Tell me what's going on. So if you notice a pattern in something, open up the dialogue. Feel free to ask. You want to look for these patterns over time and in different situations. And then, and also see the situation from your child's point of view. Being able to validate and understand where they're coming from can be really supportive. And I'll talk about this a little bit more at the end when we talk about things that you can do to help. You also want to make sure that you're observing their mood and actions objectively. So of course, our kids' behaviors, if they're throwing a tantrum, if they're saying something disrespectful to us, that understandably is going to trigger you. You're allowed to feel annoyed or upset by those behaviors. But being able to kind of take a step back and in a more sort of scientific way, gather this data, minimizing your own personal feelings for the moment, you will be doing more for your child. You will be able to show up for them and gather this data that is really important to be able to communicate to a mental health professional what some of your concerns are. And again, don't be afraid to ask the questions, name what is worrying you. When we open up dialogue, when we talk about mental health concerns, this is actually a protective factor for mental health. Some people think that we will create more problems by talking about it, but being able to be open will show your kids that you are here to talk about these things. They'll be more likely to come to you going forward if they do have a concern and if they do need your support. I'm going to go over 4 common mental health concerns for kids: depression, anxiety, ADHD, and child traumatic stress. It's not all of the mental health concerns, but they're ones that are frequently diagnosed. And for all of these, I want you to be thinking about, are these, any of these behaviors that I'm mentioning, is this outside of what we would expect for a child this age? So for example, a child who is going to school for the very first time, we would expect that that child might cling to their parent at the door. But a 10-year-old who's been going to school for some time, we would not expect that behavior. You also want to ask yourself, is this getting in the way of school performance, relationship with family or peers, or ability to participate in mutual activities? This is the child's functioning. So these are the jobs that your kid has. And if some of these concerns are getting in the way of those things, of them living their life, of reaching their potential, then there may be cause for concern. You want to ask if these signs and symptoms are present across settings. And this is not always the case. Sometimes we'll see certain symptoms are restricted to only certain settings, but generally we would expect to see things pop up in various places. And then, is this persistent over time? So for example, everyone's going to have a bad day. We're entitled to have some moments of feeling sad and down. But if that sadness extends for, let's say, 2 weeks, then there is more room for concern. And so I'll keep talking about this as we go over each of the different disorders, but just want to frame the conversation because we want you to come away from this with a healthy balance of understanding whether your child may need support, because that early identification is important, and not thinking, not sort of self-diagnosing your kids and yourselves and be leaving this talk feeling too worried. So I hope that we can strike that happy balance happy medium as we go along. First, I'm going to go over depression. And depression, the median age of onset is 13 years old. It typically onsets in pre-adolescence, adolescence, although children can certainly be diagnosed with depression. In 2015, 3 million children between the ages of 12 to 17 had depression, and depression has a recurring course. So once you have an episode of depression, you're more likely to have another one. And so this is why for depression in particular, being able to intervene early is very important. So that way you don't have it is less likely that they would have the recurring episodes and further impact on their life as they get older. In terms of signs and symptoms, you would see a change in their mood, and typically people think about sadness as the mood associated with being depressed. But especially for adolescents, that mood could be irritable. So if you notice a sharp change in your child or adolescent's mood, they're much more angry, on edge, snapping, that irritability, if it's persistent, may be a sign of depression. When people are depressed, they also don't want to do things that they usually enjoy. They just don't think that they're as fun. You may see your child may be isolating more, not wanting to see friends or come out of their room, or doing some of the after-school activities that they typically do. We often see changes in eating or sleeping patterns. So sometimes kids are sleeping more or sleeping less, eating more or eating less. And then changes in energy can also happen at either end of the spectrum. So sometimes people are fatigued and they're sluggish, they're moving slower, talking slower, walking slower, or they're more agitated and tense and restless, kind of wringing their hands, pacing the room, and you may see either of those poles. When someone is depressed, they may experience slowed thinking, difficulty concentrating. They may feel worthless, useless, or guilty for things that aren't their fault. And then they may engage in self-injury or have suicidal thoughts or engage in these behaviors. In terms of how this may present itself in your home, you might see in your child a decline in their academic performance. And this is something where you might see a sudden change. So not that this child always got C's in math, but that a child who previously was receiving A's and B's is now a C and D student. Your child may be arriving late to school, absent from school more, they're having difficulty getting out of bed, they have less gas in the tank, so it's harder for them to get up and get moving. And their difficulty with concentrating may also be affecting their academic performance. As I mentioned before, you may see withdrawal from family or friends or activities that they typically like. So someone might be a star athlete and then all of a sudden not attending practice. They may refuse to complete schoolwork, or they have sort of the sense of apathy, and or you may see increased oppositionality. So again, going along with that irritability, sometimes people will say, oh, he's surly, he's not listening, he's disrespectful to me, he's saying mean things in the house. And this may actually be a sign of depression as opposed to any overt oppositionality and kind of purposeful noncompliance. Again, we see some fatigue or sluggishness. You may hear your child make negative statements about themselves. So things like, I'm no good. Oh, I only did well on that test because it was a fluke. Or other kids don't like me. I'm never going to be able to do this well. Difficulty concentrating, we already spoke about. And then physical complaints is also sometimes something that we see in kids who are depressed. So sometimes people are not expressing some of these emotions that they're feeling, but rather you may hear them complaining about frequent headaches or stomach aches or other aches. I want to frame this around some typical adolescent behavior, especially since depression does often onset in adolescence. We see this sort of teen angst, if you will, often for teenagers. But this is going to be balanced with good school performance, healthy friendships, healthy self-development. You wouldn't see many of those other symptoms that I just described, along with some of the moodiness. And then teens will often also say, oh, I feel depressed. They will make those types of statements. But again, you're looking at the impact on their functioning, the duration, and whether or not some of these other positive aspects of their life are there, if they have those healthy friendships, if they are still doing well in school. And we also know that in adolescence that there are changes in development that naturally take place. So naturally, there are going to be sleep changes. They're experiencing more stress because they're thinking about college or vocational goals, or they have a AP test that they have to take or an admissions exam. They're going through puberty, so they're experiencing hormonal changes. And naturally, there is a process that takes place where they're learning to separate from their parents, and it's now less about you, and they don't care as much about what you think. They care more about what their peers think, and they care more about that they're relying more on themselves. And so keep in mind that you are going to be seeing lots of changes in your child naturally when they're a teenager. But when it comes to being concerned about depression, it's this constellation of symptoms that you should be on the lookout for. Now I'm going to shift to anxiety. And anxiety is actually the most commonly diagnosed disorder. There's many different disorders under the anxiety umbrella. It's most commonly diagnosed in children. And the median age of onset is actually 6 years old, quite young, but there is a range in when the anxiety diagnoses are identified. Anxiety or fear is a normal and adaptive response that tells us when we're in danger. So this is something that we are all biologically hardwired to experience. It is something that protects us. So when we see a bear in the woods, our body says, oh no, there's a threat, and it kicks into the fight, flight, or freeze response so that we can protect ourselves. Again, all animals have this hardwired. This is evolutionarily protective, and it is something important that is a part of who we are. However, anxiety becomes a problem when the body is when this fight or flight response is signaling to us that there's a danger, but there is no real danger. We think about this as an overactive alarm system, and we think about these as sort of false alarms where the body is saying that we need to protect ourselves from some sort of threat when that threat isn't there. And you'll see how this fight, flight, or freeze response really is reflected in some of the anxiety symptoms that we talk about. And what I mean by that fight, flight, or freeze response is either getting ready to attack the predator, to run away, or to freeze in your tracks, so that way the predator just doesn't see you anymore. So we also see those manifestations of anxiety in our daily lives. So again, we all experience fear and worry, but anxiety becomes problematic if it gets in the way of a child's ability to function. And just as we would with any disorder, you want to consider these factors. The first is frequency. So how often is this happening? The next is intensity. What is the magnitude of the distress? How big is the behavior that you see? What is the duration? So how long is this going on for? And do these symptoms or these behaviors persist even when the threat or trigger is taken away? So if somebody is afraid of dogs, how long are they screaming about it, crying, running away from the dog? Are those behaviors still present even when the dog is no longer there? And then finally, impairment. So how much is this getting in the way of their life? These are different types of anxiety disorders, and I'll touch upon different symptoms of these in the next slide. We're not going to go into the details about it because, again, you're not supposed to come away from here knowing how to diagnose, but this is really just to show you that there are many different ways that anxiety can present. And again, we may see that certain ones onset earlier than others. For example, separation anxiety is more likely to be diagnosed in younger children, and generalized anxiety may not appear until later. Those are just examples. In terms of what you should be on the lookout for with regard to anxiety, one possible symptom you may see is difficulty separating from a caregiver. This is when children have separation anxiety, they are worried that something might happen to their caregiver or something might happen to them, and they would no longer be able to see their caregiver again. So these are children who might cling to you at drop off. They may call you repeatedly when you're out of the house and ask questions about when you'll be back. They may really protest you leaving. They may need you there for falling asleep. They may follow you around the house wherever you go. Those are different ways that the separation may present itself. Kids with anxiety can present with frequent physical complaints, and this is kind of across different anxiety disorders. This is sort of the fight or flight response getting activated in them, and it's causing some gastrointestinal difficulties and creating some of these symptoms. Or sometimes we see that kids are asking to, let's say, go to the nurse's office because they want to avoid what's happening in class, right? Sometimes they are experiencing some physical complaint, and sometimes they also are just engaging in this behavior because it gets them out of having to do the anxiety-provoking thing of raising their hand in class or taking the test or something like that. Children with anxiety may have difficulty talking to people outside of the family or performing in front of other people. So when a child has selective mutism, they have difficulty speaking in situations where speaking is expected. They may be chatterboxes at home, but then not be able to speak in class or with a peer. And children with social anxiety are excessively shy. So we would expect teenagers to, in general, think that all eyes are on them and worry about what their peers think of them. That is normal. But when we see that somebody is having difficulty attending a party, performing in a recital, raising their hand in class, changing in the gym locker room, eating in the cafeteria, asking their teacher to go to the bathroom, any of these things would be getting in the way of their functioning and would kind of be outside of what we would expect. Kids who are anxious may exhibit perfectionism. So these are often kids who, when I get forms back from teachers, if a parent has referred their child and I like to talk with the teachers as well, teachers will often tell me, this is my favorite student. I can't believe that you're talking about this kid, because they're eager to please and they're quite compliant and they want to do well. But there may be a lot of internal distress around doing things exactly the right way, getting things done perfectly, reaching their potential. So you may see your child erasing or rewriting an answer multiple times, or they get a 95. And then rather than saying, yes, I got an A or I got an A plus, they instead are saying, oh, I can't believe I missed those 5 points. And they're really hard on themselves about that last 5 points. So again, it may be something where it seems like, okay, this is an A student, she's doing really well, but internally there may be more concern and more distress. People with anxiety often avoid certain situations. So as I mentioned before, a child who doesn't want to take the test or raise his hand in class may ask to go to the nurse's office or ask to go to the bathroom. We also see that, especially when it comes to something like a specific phobia, so a fear of, let's say, needles, dogs, bugs, thunder, whatever it might be, that they may avoid those specific situations. So child sees a dog walking down the street and crosses the street. Or a child does not like getting shots at the doctor and so engages in a behavioral outburst right before going to the doctor. These are ways of getting out of doing the thing that makes them feel very uncomfortable. Again, this avoidance can apply to many different things and can apply across anxiety disorders. People who feel anxious may also engage in what's called reassurance seeking. And this is a way that they're trying to manage their anxiety. So if they're worried about something, let's say they are worried about getting sick from eating contaminated food, then they might ask you repeatedly, am I going to get sick if I eat this? And then you would hear these questions over and over again, and they're relying on you as their parents to provide them that comfort. And of course, as parents, we want our kids to feel better. So we say, oh, yeah, don't worry, you'll be fine, everything's good. But if you hear any of these questions repeatedly, know that this may be a sign that they're struggling with anxiety, and it's a way that they're trying to manage their anxiety, but in fact, it's making the anxiety bigger and stronger because they are looking to you and you're immediately letting that anxiety go down by providing that reassurance. And so sure enough, that reassurance cycle continues. Next, we have behavioral outbursts or tantrums. And what's interesting is that this symptom is actually not in our diagnostic and statistical manual, the book that we use to diagnose any mental health disorder. This particular line is not in any of the anxiety disorders as a symptom, but it is certainly something that we see can come along with anxiety disorders very frequently. And as I mentioned before, this is because it is very possible that it is a way that children are getting out of doing things that they don't want to do. So it's also that their fight or flight response is being activated and they're engaging in these behaviors. So sometimes a tantrum is really just to, get the lollipop in the grocery store because that's what you want, or because you're upset that you got screen time taken away. But sometimes the tantrums or outbursts may be a sign that the child is experiencing significant distress or is trying to get out of a situation that is making them feel anxious. And then finally, difficulty tolerating uncertainty is again kind of a core common feature of anxiety disorders. And this is where we see that kids need that reassurance, or they need to kind of plan ahead and have everything just so, and not be able to tolerate that the plan might change, or that things may be different than we expect, or that we don't know exactly how it's going to turn out, but that's okay, that we can handle it. So again, because we have so many different types of anxiety disorders, there are many different ways that it may manifest, but these are just some of the things to be on the lookout for with regard to anxiety. Now I'm going to move to child traumatic stress. And first, this is not a disorder in the DSM. Post-traumatic stress disorder is a disorder in there, but overall, child traumatic stress is something that occurs when kids are exposed to frightening events that involve real or perceived threat of harm or death that overwhelm their coping abilities and affect their daily functioning. So we all will experience stressors, or we may come into contact with a scary event, and that might impact our ability to sleep. It might activate us. It might be something that changes our mood. But over time, we're able to make sense of what happened, to incorporate that back into our life, and to be able to go on to do the things that we're meant to do. But for some kids, they are not able to, they're kind of stuck in that recovery process, and they're not able to return to their tasks of daily living, and they're not able to cope with those things. And the the factors that can impact whether or not somebody is able to experience that recovery or not include individual factors, both biological and whether or not that person has experienced a trauma before. Factors of the event, so how close that event was to the person. So was this a loss of a close family member or a further family member? Was this an assault that they experienced, that they witnessed, or that a family member experienced? And then post-event factors. So whether or not that person had social support or if there were other stresses in their life that were occurring after the event. These are all different types of traumatic experiences that a child may experience. And as you can see, there are many different kinds, and the estimates range quite significantly from anywhere from 8% up to 70% are some estimates for witnessing community violence, for example. So many children will experience one, if not more, of these events. But just because somebody experiences one of these events does not mean that they go on to develop PTSD. So only 16% of kids who experience one of these traumatic events will go on to develop PTSD. And then the other important thing to know is that stress does not equal trauma. So stress is a situation that causes anxiety. It also calls on our coping abilities, and we have to do what we can to manage that situation and continue to foster our own well-being and contribute to our community. But trauma is the threat or actual injury to the self or other. So there's a distinction between stress and trauma. And then just because you experience a trauma does not mean that you go on to develop PTSD. But I will go over what you might see if a child has experienced a trauma and may be experiencing PTSD. The first is a change in school performance. So children who have experienced trauma do show changes in their attention and memory and other cognitive skills that are needed for school performance. We also know that kids are more fatigued, and they may have more nightmares. They may have difficulty sleeping, which would also affect their school performance. They're not able to attend to the day and get their work done as one might expect. You may see irritability or anger outbursts. Again, that fight or flight response is activated, and so that fight may be coming out more frequently. They're perceiving threat because they're trying to protect themselves after a traumatic experience. There may be other changes in mood. They may be on edge or startling easily, so they're hypervigilant. They're looking around and scanning the environment to try to keep themselves safe. They may avoid certain people or places. So for example, if a trauma occurred, if a child was assaulted on the playground, they may all of a sudden not want to go to that playground, or you may see that they now want to walk a different route to school if they don't want to go to the place where the trauma happened. They may withdraw from activities, peers, or school, and they may have difficulty with peers. Again, that kind of fight response may activate behaviors that make it difficult to get along with other people. And then sometimes we see that kids are more hopeless or have difficulty thinking about their future. As you can see from this list, there are many behaviors or symptoms that are similar to what I went over for anxiety and depression. So again, you're not meant to be the diagnostician, but just something to be thinking about if you're seeing some of these constellation of symptoms. But again, just things like changes in mood, things like fatigue, these are the types of things that might signal needing to seek support from a mental health professional. Okay, the last condition that I will go over is attention deficit hyperactivity disorder. And this is a mental health disorder that is typically diagnosed between the ages of 7 and 9, although certainly we often see symptoms much earlier. That's just the average time that it's finally noticed and people seek support and diagnosis for that. ADHD has there are actually 18 possible symptoms of ADHD, and the symptoms fall into two different clusters. One is inattention, symptoms of inattention. So this is difficulty focusing and concentrating, as well as other difficulties with executive functioning, like planning and organizing and keeping track of your materials and things like that. And then there's hyperactive and impulsive symptoms, things like fidgeting, interrupting, etc. And you can be in either one of those categories, or you can have combined type, which is having symptoms from both categories. And most kids that are diagnosed with ADHD are diagnosed with the combined type. But it is important to know that you might only have 6 of the symptoms from the inattentive category. And so you might look very different. The child with ADHD inattentive type might look very different from a child with the hyperactive impulsive type. So I'm going to go over symptoms of ADHD, but just know that kids with ADHD really may not look alike. But kids with ADHD may be daydreaming a lot. They may look out the window, have difficulty focusing on the speaker. They may have difficulty following instructions. These are multi-step directions where if you say, get your bag, oh, don't forget your lunch, and put on your shoes, being able to hold all that in their mind and execute can be challenging. Some parents also say that they think that they're kind of tuned out, right? That the kid is so focused on what they're doing that they don't even hear some of the directions. Kids may forget or lose things frequently. So you've had to buy 10 different scarves and 3 different AirPods, and they're constantly leaving their books at school. Kids may also make careless mistakes. So they're rushing through assignments. They're not reading all the details of the particular problem. They may, they're very bright, so they understand that, okay, this is how I do division, this is how I do long division, but then they make a careless error like 1 + 1 = 3, and then they don't receive credit for the problem, or they're rushing through the work and they don't show their work. And so they get points off because yes, they arrived at the right answer, but they didn't go through the steps. Those are common concerns that I will hear from teachers. Kids with ADHD may have difficulty organizing their materials. So they open up their backpack and it's just sort of a explosion of papers, or they have difficulty planning for long-term assignments. So being able to break it down and say, okay, if my paper is due next week, first I have to do my research, then I have to make an outline, then I have to write this, then I have to do some peer editing. Being able to break it down and plan ahead for that can be challenging. And there also may be procrastination. So it's much more fun to do the thing that is reinforcing right now, like talking to my friends or playing video games, rather than saying, okay, I should do this work first and then I'll do fun after. We see that kids with ADHD have difficulty completing their routines. So getting out the door in the morning is a struggle, getting to bed at night can be a struggle, or completing their homework. So sustaining their focus and effort on something that can be challenging like homework, and something that is maybe not as fun is really hard. We may think that kids are fidgeting, often have things in their hands, or squirming around in their chair, getting up out of their chair. They may interrupt conversations, whether with parents or with their peers. They may talk a lot and both out of turn when they shouldn't be in class, and also just having very elaborate stories and just really just saying many things about a particular topic. They may have trouble waiting their turn, whether they're waiting in line at the grocery store or waiting for their turn in a game. They may start moving their piece before it's their turn. And then of course, all of these behaviors can often make it difficult for them to get along with other kids. So if they're barging into a game, or if they're getting distracted when another peer is trying to tell them something and they're not picking up on all of the details of the conversation, this can impact their relationships with peers. We do see that there are changes in how ADHD presents across development. And in preschool, we typically see the hyperactive and impulsive symptoms. And this makes sense because in general, preschoolers are more hyperactive and impulsive. So, but kids with ADHD are more so than their peers. But we see the inattention symptoms and the difficulties with planning and organizing those other executive functions. We see that come online in school age. And this is because the demands are for those things are greater. So school is no longer about working together to build a tower of blocks as your math unit. Now you have to sit at your desk and look at the teacher and focus on what they're saying, and then stick with something and make sure you're bringing all the right books home. So the demands of what are required of a student as they grow through the elementary years, those increase. And so we start to see the inattention and executive functioning difficulties are more present. By adolescence, those difficulties with inattention are still certainly there. And then we also see impulsivity that's showing as risky behavior or substance use, things like reckless driving, things like that. And again, this makes sense because many adolescents will start to engage in more risky behavior. They think that they're invincible, that nothing bad is going to happen. Their brains are not, their frontal lobes, which are responsible for executive functioning, even without ADHD, are not fully developed. So again, this makes sense developmentally. And in kids with ADHD, we see that they have these challenges even more so than their peers. And ADHD does persist into adulthood in about 2/3 of cases. So again, the sort of wait and see approach is not going to be helpful for kids who may be struggling. These symptoms do often persist, and getting treatment is very important. So if you notice any of these signs and symptoms, if you have concerns about your child, how can you help? First, I'm going to talk a little bit about just overall how to promote your child's well-being and to promote their overall mental health in the home. The first is to normalize and validate their reactions. So what do I mean by that? You want to let them know that what they're experiencing is typical, right? So I know how much you want to see your friends right now. Everybody really misses seeing their friends during the pandemic. Or it's understandable that you're nervous about this test. This test is an important one. I totally get that. Like, a lot of people are feeling stressed about this test. So let them know that they're not alone in how they're feeling. And then the second is to validate the reaction, which means that you are recognizing why that thought, feeling, or behavior makes sense in a certain situation. So you might not agree with the fact that your child, your teen, let's say, wants to extend their curfew to 1 a.m. You may think, okay, that's ridiculous, but you can still validate, I understand how important it is for you to see your friends. I know how much going out with your friends means to you. And these are the reasons why this is referred to. But being able to validate and say why that feeling or thought or behavior makes sense in the situation is so important. I'm going to talk a little bit more about validation because it is so key, because when children feel listened to when they raise concerns, this is an effective factor for their mental health. But it also is often not our first reaction. So if your child comes to you and says, I'm really nervous about this test, it doesn't feel good when we see our kids suffering. So when we hear them say a negative emotion, we want to make them feel better. We want to either erase the emotion or help them solve the problem, right? So you might say, oh, you're going to do fine. You studied so much. Don't worry about it. But that actually might be invalidating. That actually might be telling them that having that feeling is not okay. Or the other thing that you might do is say, okay, like, what can I do? How can I help you? Do you want to study more? Do you want to make flashcards? So you want to leave that space for validation where you can say, I hear that you're feeling nervous. I understand how important this test is to you. After you have that space for validation, then you can say, how can I help? What are some things that I can do to help you feel better? Because I know that you've studied a lot. So I can't emphasize enough how important that skill of validation is. The next is to talk about it. You want to ask open-ended questions. As I mentioned at the beginning of the presentation, if you notice something, ask about it. You also want to provide age-appropriate information. So depending on the age of your child, give them information about what's happening in the news, what is happening in your local community, what's happening within your family. You want to model appropriate disclosure and discussions. So let's say you're struggling with a feeling that you're having, you can disclose that again in an appropriate way. You don't need to tell them all of the details if it's not appropriate given their age, but being able to say, I can talk about my mental health, and so you're opening the door for them to talk about theirs. And then talk with your children, not just at them. So lecturing them about something is not going to be as good as hearing their perspective. And again, asking those open-ended questions that will really open up the dialogue. Next, you want to remain or at least appear calm. So I have a colleague who talks about, you want to think about being a duck who's sort of gliding on the surface and seems super calm and tranquil, but really underneath those feet are paddling. So you may internally be struggling and doing a lot to manage your own stress and emotions. But if you can show that calmness on the outside and be a calm force for your children, that is incredibly important. And even if you aren't able to, even just talking about that out loud, right? I'm feeling angry right now. I'm feeling really stressed out. I'm going to go take some time to take some deep breaths and calm down. And then you can leave the situation and work on utilizing your own coping skills. But that can really show your children how you're hoping that they would behave too if they were experiencing a big emotion. They say that when you're in the airplane, when those oxygen masks come down, you have to put your mask on first before helping the children next to you. And the same thing goes for your own mental health. So you should focus on your own self-care, as hard as it is, because it's another thing to be thinking about, but focus on your own self-care. That will help you be able to help those around you so much more. Also along these lines, avoid harsh criticism and punishment. Oftentimes when we react out of those big feelings that we're having in the moment, so frustrated with our child's behavior, we may say something harsh, give a big punishment, yell at our children. That's only going to serve to deteriorate the relationship and maintain those problem behaviors. On the flip side, if you are able to focus on relationship and build that positive relationship, you're going to do a whole lot more to promote your child's well-being. So some things you can do for that are spend one-on-one time with them when possible. And again, I know that parents are very busy, but even if you're able to devote 5 to 10 minutes a day where you're not looking at your phone, you're not thinking about anything you have to do, you're not telling your kids what to do, you are just 100% following what they want to do. They're doing something that they like, you're following along with them. You're using this time to talk about what they want to talk about. It's not about the agenda of the day or how was your day in school or anything like that. If you're able to, even just that small chunk, it's like brushing your teeth. It is a way to prevent, it's a preventative behavior that we engage in on a daily basis to promote overall health and well-being. And you also want to provide consistent positive feedback. So being able to give your children praise, specific praise for the things that you like. And you can think about what it feels like from your own boss when you get feedback from them. You're much more likely if they say, oh, hey, I really like the way that you reached out to the team with this email and gave them a heads up about what to expect for this conference. If you hear that positive feedback from them, you're going to be much more likely to do that again next time. And the same thing goes for your kids. If you give them feedback, thank you for being so flexible about that. Really appreciate you listening right away. Thank you so much for completing your homework without me asking you. If you provide that praise to them consistently, you're going to fill up their cup, you're going to build your positive relationship, you're going to help grow those behaviors that you want to see. And finally, you want to provide clear and consistent routines and expectations. Kids thrive on consistency, and even if they are not always going to ask for it, right? They may say, oh, why do I have to wake up? Why do I have to brush my teeth? But it is something that is really grounding for them when they have these specific routines, especially during the pandemic when things are so uncertain. Having that consistency and having something that they can really lean on is, again, very grounding and very important. In terms of accessing additional support, If you aren't sure, just ask for help and encourage your kids to do the same. So again, all those other things that I just went over, how to promote well-being overall. But if you are concerned about any of the signs and symptoms that I mentioned, seek a referral. You can talk to your child's pediatrician, school, or other community organizations and ask what's going on and see what the mental health professional has to say. And then also don't forget to rely on other people in the child's life. So it really does take a village to raise a child. And if you have open lines of communication with teachers or other important adults in your child's life, they will also be able to shed important information on the situation and having them involved in your child's life in terms of their treatment plan will also be really important for your child's success and being able to overcome anything that they're struggling with. Please visit childmind.org for more resources on children's mental health. Two resources I want to highlight in particular are the Parent's Guide to Getting Good Care. I don't have time in this presentation to go over all the different steps, but this has questions that you can ask your provider to ensure that you're getting a good diagnostic evaluation, to ensure that you're getting effective treatment. It has different types of mental health professionals and who to go to for which types of concerns. So I invite you to take a look at that if you're interested in taking the next step. And then our symptom checker is not a diagnostic tool, but it is a place where you can check off different concerns that you have about your child, and then it will suggest, okay, maybe you want to look into this disorder, maybe you want to look into these resources. So it's a way to point you in the direction of possible resources, but again, is not meant to replace a diagnosis with a trained mental health professional. And then finally, effectivechildtherapy.org is another website that has information on effective treatments for various disorders and where to find help. So they have links to other therapist directories and finders where you can try to locate a provider near you. Thank you again for being here today. Again, you taking the time to be here is the most important step toward you being able to support your children. And I hope that you stay well. Take care.
Thank you so much, Dr. Mendel, and thank you everyone for joining us today. That was a fantastic discussion. It could be not more timely. And again, take care, everybody, stay well, and we hope to see you again soon. Thank you.